Healthcare management is the study of certain aspects of the healthcare field, including the areas of healthcare policy and reform, international healthcare systems, the economics of healthcare, and quality assurance, just to name a few, as it strongly relates to the prevention, treatment, and management of illness. For those interested in the healthcare management field, you will find that employment opportunities are everywhere as the healthcare system grows with our aging population. Healthcare administrators are most commonly leadership, management, or administrative roles. The business sectors are wide open for you, with options in both private and public healthcare systems, hospital networks, or even major healthcare insurance providers. Healthcare is currently the fastest growing industry in the United States, with over 13% of the country's jobs being in healthcare. The need for highly qualified people to lead healthcare facilities, businesses, and initiatives is rising. As healthcare transforms in the U.S., so do the necessary skills associated with relative positions. For example, good communication is one of the most important abilities for a healthcare administrator to possess. This skill allows leaders to share a common goal, influence, encourage, and engage diverse teams to reach and exceed goals, yield high outcomes, and obtain positive fiscal responsibility in the healthcare industry. The role of a healthcare manager or administrator is critical. They are instrumental in talent recruitment and retention, succession planning, and can even be associated with shaping the actual health policy itself. An ultimately important responsibility of a healthcare manager is to improve the quality of care that is being given, as well as monitoring the efficiency and efficacy of their facility. Many of the current issues facing the United States revolve around the healthcare system. Healthcare administrators face issues every day, such as rising insurance premiums for their patients, or even the large deficit in healthcare spending. A huge price disparity in the cost of the Patient Protection and Affordable Care Act has been a topic of debate within healthcare for quite some time. The federal budgetary allocation dedicated to the recently started national healthcare system, Obamacare, has increased spending on the administration of healthcare by nearly $273 billion, with new taxes covering only about $140 billion of that total deficit, just exemplifying the importance of competent and savvy businessmen and women who are experienced in the ever-changing healthcare field. Current challenges exist, as will future difficulties in healthcare. It is the responsibility of healthcare administrators to responsibly handle those issues. As knowledge on fighting disease grows, and innovations in technology are brought into fruition, the attention of healthcare management is starting to shift from how to care for patients to now how can we maximize and utilize equipment, drugs, and new therapies that are available to patients. Total healthcare spending in the United States is expected to reach $4.8 trillion in 2021, up from $2.6 trillion in 2010 and a mere $75 billion in 1970. To put those figures into context, this means that healthcare spending will account for nearly 20% of gross domestic product, the GDP, or 1/5 of the U.S. economy's spending by 2021. With such a large growth expected, it is of paramount importance that the healthcare industry acquires quality administrators who will be prepared to handle the changes that are soon to come.